The urinary system, and particularly the kidneys, are a very interesting part of the body. As we saw in the cardiac chapter and in some of the other chapters, the kidneys sort of have their hand in on a lot of stuff. The kidneys are very important. You can't live without at least one functional kidney. So if you don't have at least one functional kidney, you're on dialysis until you get one transplant. So kidneys are really important, and the urinary system itself is pretty important. So we'll talk about it. So learning objectives. The urinary system removes metabolic wastes from the body, removes hormones from the body, removes drugs and other foreign material from the body. This is good. All these things need to be removed. It regulates water, electrolyte, and acid-base balance. And as we know, those are pretty serious systems in our body. It secretes erythropoietin, which erythropoietin is the hormone that stimulates the production of red blood cells. Super important. When you watch, if you watch professional cycling, and you watch the Tour de France and stuff, and they test people and they talk about blood doping. That's what they mean by blood doping. They're artificially injecting erythropoietin to produce more red blood cells to make you more cardiovascularly efficient. But usually the kidneys do it. The kidneys activate vitamin D. So vitamin D has a lot of different functions in the body, and you need the kidneys to activate it. And the kidneys regulate blood pressure through the renin, angiotensin, aldosterone system. So they're major players. They're very, very important for maintaining homeostasis. So the kidney has tons and tons of functional units called nephrons, and each kidney has over 1 million nephrons, so lots and lots of them. And they're arranged in these little lobes, and they're highly vascular because every bit of blood in our body has to go through the kidneys, go through a nephron, and get filtered and whatnot. So when we don't have a kidney, the dialysis takes the place of that. It doesn't do the best job of it, but it keeps you alive. So like the liver, the kidney has many repetitive units because the function that it does is really important. So we have to have all that backup function. That's why you can lose one kidney, but not both. It's a system that's so important that we have a backup. So I always think about that, because remember in the acid-base chapter way back when we talked about that, there are lots of different backups on backups on backups for the system because it's so important for keeping us in homeostasis and keeping us alive. It's the same thing with the kidney and the liver. It has backups and backups and backups to keep us going. So really, I'm not going to talk about all the different detailed functions about the nephrons, but just suffice it to say we need kidneys. We need at least one. So then we'll go right into disorders of the urinary system. It's a really short little kidney thing. If you want to know more about kidneys, we'll talk more about them. But incontinence, you will encounter in the clinic in various forms, no matter what setting you work in. There are specific therapy modalities to treat incontinence. In your special topics class, you will have a specialist in pelvic health come in and they'll talk about incontinence. They'll talk about a lot of other really interesting things. So this is an area that we do treat in physical therapy. But incontinence is voluntary loss of voluntary control of the bladder. So enuresis is involuntary urination by a child age older than 4. That's like the common term for it is bedwetting. It's often related to developmental delay, sleep pattern, or there's a psychosocial aspect. Stress incontinence is more common in women, but it's not unheard of in men. The pelvic health area of physical therapy used to be called women's health, but it's not just women that need this type of therapy. A lot of times men as well. So increased intra-abdominal pressure forces urine through the sphincter. So coughing, sneezing, lifting, laughing. Multiple pregnancies can make it worse. Other things can affect stress incontinence. Overflow incontinence is where you have an incompetent bladder sphincter. It's more common in older adults. Weakened detrusor muscle can prevent complete emptying of the bladder and increase frequency of urination and cause episodes of incontinence. Spinal cord injuries or brain damage. You have neurogenic bladder, which can be either spastic, overactive, or flaccid, underactive. And the spinal cord or brain injury interferes with the central nervous system and the autonomic nervous system voluntary controls of the bladder. So a lot of people with spinal cord injuries, which I work with a lot in the clinic, have neurogenic bladder and need to self-catheterize. They don't have a normal bladder response. Urinary retention is the inability to empty the bladder, and it may be accompanied by overflow incontinence, where it puts extra stress on the detrusor muscle. Spinal cord injury at the sacral level blocks the micturition reflex, and it might follow in general or spinal anesthesia, and that's temporary in that case. But that's where they might catheterize you in the hospital, or people with spinal cord injuries have to learn to self-catheterize. So they can get rid of their urine. So the test that they do for urinalysis is, or the test that they do for urine is called urinalysis. And there's lots of things you can find out from people's urine, which is interesting. So they look for the color, the odor, and the specific gravity. If it's cloudy, it might indicate the presence of protein, blood bacteria, and pus, so it could indicate an infection. If it's dark, it could be blood in the urine or excessive bilirubin, which is a liver or red blood cell dysfunction. Or it could be highly concentrated because you're dehydrated. An unusual or unpleasant odor can be a result of infection or certain dietary components or medication. So I used to work with one nurse in the skilled nursing facility, and she could smell a urinary tract infection. She had smelled so many of them and had acute sense of smell or something. She was like a dog that could detect that. And she'd walk into somebody's room and she'd say, get a culture and sensitivity right away. And she was right all the time. So that unpleasant or unusual odor, that could be an infection. And that can be pretty serious in an elderly person. Heavy purulence, which is presence of pus, or the presence of gram-negative or gram-positive organisms can be present with a urinary infection. Small amounts of blood in the urine can indicate infection, inflammation, or tumors in the urinary tract. Large amounts of blood can be caused by increased glomerular permeability or hemorrhage. So any amount of blood in the urine is something they need to look into it further. Elevated proteins in the urine can be leakage of albumin or mixed plasma proteins in the filtrate, indicating tissue damage someplace in the body. And bacteria in the urine means you have an infection. So they do a culture and a sensitivity, just like you do with bacteria anyplace else in the body. Urinary casts are little solid inclusions that indicate inflammation of kidney tubules. The specific gravity of urine indicates the ability of tubules to concentrate the urine. So low specific gravity is dilute urine with normal hydration, and high specific gravity is concentrated urine. It's related to renal failure. Glucose and ketones, they test for when diabetes mellitus isn't well controlled. You have increased glucosuria, increased glucose in the urine, and ketouria, which is increased ketone bodies in the urine. For testing, blood tests that they do for urinary problems, elevated serum urea and serum creatinine levels can indicate failure to excrete nitrogen wastes. So that's caused by decreased glomerular filtration rate, which is the GFR. So the GFR is important. It's an important test of kidney function. Metabolic acidosis indicates decreased GFR, and it's just the failure of the kidney tubules to control the acid-base balance. Anemia, in the absence of other problems, because you could have other things causing anemia, can indicate decreased erythropoietin secretion and or bone marrow depression. So, as you know, many things can cause anemia, and it's complicated, and they have to figure out what the original cause is. They're testing for electrolytes, can depend on what their fluid balance is. Antibody levels of certain antibodies, they can diagnose post-streptococcal glomerulonephritis, which is an infection. It's a kidney inflammation after an infection. Increased renin levels can indicate that the kidney as a cause of hypertension. And culture and sensitivity is used to find the causative organism and select the appropriate drug treatment for an infection. So other tests that they can do with kidney function include radiological tests. So any kind of imaging, lots of different imagings, to visualize structures and look at flow patterns and filtration rates. Clearance tests like creatinine or insulin clearance to assess the glomerular filtration rate. It's basically how long does it take to get out of your system. Cystoscopy, which visualizes the lower urinary tract to perform a biopsy or remove kidney stones, and a biopsy to acquire tissue specimens if you're looking for cancer. Because bladder cells are very changeable, that is an area where cancer frequently occurs, especially in elderly people. But the good news is that it's easy to treat. So if you're going to have cancer, it's better to have one that's easy to treat.